A shocking 12% of you were discussed hormones with your last provider physician visit. 12%, when a woman will go 50% of her life without hormones. Probably more because hormone loss starts now around 35 to 40. So if you live till you're 80 or 90, what happens to your bone? What happens to your skin, your well-being, your mentation, memory, on and on. Why were the hormones taken away, and why are only 12% of people being discussed as per my YouTube community area where I polled you? That's what I'm talking about today. You'll understand exactly why they were taken away, and should you be talking about them and discussing them for your longevity and to have a better life for you as you grow older. You're going to need to take charge yourself, unfortunately, on this one, and look out for yourself. Let's dive in. Well, bioidentical hormones technically were the first used in menopausal symptom relief. In the 1930s, there was a Canadian researcher, James Collip, and he developed a method to extract an orally active estrogen from the urine of pregnant women. So you could take it by mouth, it was extracted from a human, a woman, and marketed as an active agent. It was called Emmenin. And that product was, of course, bioidentical, exactly what's in the human body because it came from humans. It was replaced on the market when its manufacturer, which was Ayerst at the time, began producing the more easily manufactured conjugated equine estrogens. And that was, as I mentioned, 1941. And that was the brand name, which you're going to know, Premarin. As the name implies, it came from a pregnant mare, a horse. P-R-E for pregnant, marin, so mare, the horse, Premarin. And in 1992, Premarin was, listen to this, the most widely prescribed drug in the United States. Okay, the most widely prescribed drug. In 2000, 46 million prescriptions were written for Premarin, conjugated equine estrogens, and that made it the second most frequently prescribed drug in the United States. Okay, we have to stop here. For this to be anything relevant to you, you need to know about the study as to why everyone was taken off of the hormone replacement therapy in 2002, the Women's Health Initiative study. First of all, look what the newspaper said. Hormone therapy can double the risk of breast cancer. Here's a bunch of other articles, but these are indicative of what hit the papers. Expert panel warns backing off of hormone replacement therapy. Hormones are bad. It was all over the headlines. And what they read was mainly what they took, the narrative they took was the breast cancer risk. And that's what took everyone off of it. Now, if we look at that trial, huge undertaking, almost 70,000 women over almost 7 years. The initiative started around 1991 and parts of the trial still going on today, but it spanned 7 years at the time. So it continued past, of course, 2002, but the data from the trial came out and that's what it read. If we look at it, and how does that apply to you and is it real? Were those results overinflated? So when you do a study, there were two arms to that study, meaning there were two different groups of people, women with a uterus and women without a uterus. If we take the women without a uterus, you don't need progesterone. So they had estrogen or placebo. If you take the women with a uterus, you can't have unopposed estrogen. So they had estrogen and progesterone therapy or a placebo. Okay, so those are the two main arms of the study. So that's good because we can get more data out of those two arms and see what happens. Now, here's a couple problems with the trial and why it isn't fully applicable to today or maybe to you in terms of bioidentical hormones. There were no bioidentical hormones used. They were all equine based or what people call those synthetic hormones. So you got to understand that first. Second is that you're looking for an endpoint in a trial. In over 7 years, of course we'd like it to be over 70 years or longer, but you can only go so long. So over 70 years, if you're looking for an endpoint, which is death or bad things happening, you can't pick 40-year-olds, you can't pick 50-year-olds, you'd rather pick 65 to 75-year-olds plus, because there's more likely chance that something bad will happen. You can measure outcomes. That's the way it works. So even though the age range was 50 to 79, there were much more older people in the trial. Nowadays people are coming in at 45, 50, much younger, less morbidity going on. So keep in mind that the results of this trial would more so apply to older people. The next thing was, of course, if you want to see endpoints like death or bad things, you pick what? Unhealthy people. Those with diabetes, those with obesity, those who smoke or have bad habits. So in general, it was an older group of people with unhealthy conditions to start with, and that kind of takes away the point of representing what might apply to you if you are younger and healthier, which is overall what we're seeing come into the practice. Now let's look at the data. So if you take this increased risk of breast cancer in terms of an absolute number, a lot of times we do events per thousand in trials. It was on the order of 25% of an increase. What does that mean? That's huge. If I said to you, you got a 25% increased risk of something bad happening, you're like, that's bad. However, think about what 25% is. If you go from 4 in 1,000 to 5 people in 1,000 who got breast cancer, that's one extra person in 1,000, but that is a 25% relative risk change. So the headline does read right, but in absolute numbers, it's not as bad. It's one person of 1,000. Of course, we want 0 people, but it's one person in 1,000. So you have to understand that benefits outweighing the risks and quality of life. However, here's the key point. That was in the progestin arm. So those on estrogen and progesterone. You might ask, what about those on estrogens alone? So those without a uterus that just took the estrogens, because the estrogens are what's in question for many people. And here's the deal. There was no increased risk of breast cancer for those on estrogen alone that did not have a uterus. In fact, maybe you'd argue there's a slight decreased risk, not maybe, but there was a slight decreased risk. Also, what's interesting, those patients, their mortality overall and morbidity was lower. So they had less other problems going on in their life that caused health problems. So they were healthier. And that was in the estrogen only arm. So when you hear people say it's the progestins that are the problem, the horse-based progesterone, that's what they're talking about. In that trial, that was the arm of the trial where people had an increased risk of breast cancer, yes, from 4 in 1,000 to 5 in 1,000, somewhere like that, was that arm. So that's why a lot of people say, well, the estrogens actually didn't cause a problem. And there's a whole group of people who are dead against this trial. I like trials. You critique trials. As physicians, as medical providers, we critique each other nicely when we go to these meetings. We critique each other so we learn. A lot of people in the meetings, when we're critiquing each other on stage, because we do that now, we have sections of conferences where we dispute each other, where we dispute findings, where we have alternative points. This is a good thing. So there's data from the trial that you can use, but that's what you can extract. And part of the key here is there is no data on bioidentical hormones, the plant-based ones. It comes from the synthetics. So now you know what happened in 2002 and why everyone was taking off their hormone replacement therapy. So if you liked that short clip, watch my complete YouTube video by clicking here on bioidentical hormones, or click down here to watch my complete playlist on things you can do like microneedling and chemical peels at home. Keep your skin and body beautiful, healthy, and vibrant.